Okay. Well, so I'm Jeanice Mitchell, pelvic health physical therapist, and I'm in Texas and Georgia, but we are interviewing you about premature ejaculation. So I'm so excited to be talking about it. And I love your personality. So
thank you.
Okay.
Thanks for having me.
Yes. So please tell us a little bit about yourself and some of the programs that you developed, and then we'll also talk more about that at the end as well.
Oh, sure. Yeah, so I'm Susie Gronski. I have a doctorate in physical therapy. I'm a certified pelvic rehab therapist, and I found myself creating a special niche to treat male-bodied persons, particularly those with pain and sexual dysfunction. So the topic we're talking about today is premature ejaculation, and I feel not a lot of male-bodied people out there understand their parts and that there's help for premature ejaculation. So I'm really excited to be here to talk about, well, what is it? How do I know if I have it, and what can be done for it?
So I love it. Awesome. Okay, well, so let's just jump right into it then. What is it?
Right. Okay. So premature ejaculation, although, the medical society wants to put a label or a definition on things to make things easier to diagnose, in essence, it's anytime a guy ejaculates when they don't want to. Basically.
Okay.
It's early ejaculation. If you look at the literature and the research, they'll tell you that it's less than a minute. But I will argue that it's any time in that trajectory of intimacy or sexual function that guy just isn't ready for it to happen. Oh. And so that can be quite distressing. So it doesn't have to be time dependent.
I like that.
It depends on your particular issue with what you're experiencing in your own body and in your relationship, and whether that's, like causing stress in your relationship or with yourself. Right. So I like to preface that right off the bat.
I think that is not
huge. Time dependent.
Yeah, because somebody, okay, so because if you only categorize it as less than a minute, then if somebody is ejaculating at 3 minutes and they're not pleased and their partner isn't pleased, what category do they fall into, right? So they could still fall into the premature ejaculation category.
Yes. Yeah, if it's causing you stress and you're worried about it, then it's a problem and we need to kind of address it. And a lot of the research out there does follow the less than a minute category for improvement. But like you said, Jeanice, it's like, if it's 3 minutes, what if it's 4 minutes? Again, it's a sense of loss of control when you don't want things to happen that way. It's
not happening at the right time.
Yes, correct.
Mm-hmm. Beautiful. Okay, so we have a lot of audience questions here, so I'm going to just jump into it, and they might be scattered a little bit, so I'll try to organize them as much as possible, but it's going to go around. So tell me, is it just a mind thing? What causes it? What causes premature ejaculation? Is it just the mind? Is it the muscles? What's the cause?
There is no known single cause. I'm sure this comes to a shocker to a lot of people, but there isn't. There are lots of theories out there, but not necessarily one single cause. So, and to preface the mind thing, the mind comment, yes, there is a psychological component because it's like once bitten, twice shy. If it happens once, it's very alarming to you, and you get a sense of oh my gosh, is this going to happen the next time around and the next time around? Very similar to erectile dysfunction. So you can't separate your emotions and your feelings with what's happening in your body, or a lack of control of what's happening in your body. So yeah, to some extent there is a psychological or psychogenic component, but it's not the only thing. And on the other flip side, you do have muscles here. I have my models and stuff, so I can kind of definitely, it's helpful with visuals.
Yes.
This is a male pelvis, a male-bodied pelvis here. So we have the anus and the base of the penis here. The testicles or the scrotum is not here, but you have the muscles. And the nerves that innervate these muscles have motor control and sensory function, but they also communicate with your visceral structures, which are your bladder and your prostate. And there is an ejaculatory reflex, so that is driven by the nervous system. Your brain and your spinal cord are very much part of you, and your brain so happens to be in your head. So most people like think, is it in my head? Well, the organ, which is your brain, is one that is controlling these reflexes from a top-down perspective. So it's all connected, it's complicated, and we can't really put things in a vacuum.
No.
Does that answer the question?
Yes, yes. So going back to it, so somebody may not understand what motor control means. So motor control meaning that we can squeeze those muscles and they do what we tell them to do, right?
Correct. Yeah. So you can squeeze and let go at the same time. But I will preface that once someone is reaching ejaculation or in that kind of phase of its liftoff, there's no stopping that at that point.
Yeah,
like, like it's gonna happen, and you wouldn't want to stop it.
Yeah.
It's like you're having a good pee, and then all of a sudden you stop midstream.
Yeah.
It doesn't feel really comfortable.
Yeah.
You can do it, but it's not comfortable, and I wouldn't recommend. You know, but when we talk about treatment approaches for premature ejaculation, part of the training is being aware of this part of your body, how those muscles work, so you can have greater control of those muscles, and that in turn can help and benefit the bedroom and your ability to control, you know, reaching orgasm or ejaculation. Orgasm and ejaculation are not the same thing. Ejaculation is a mechanism, orgasm is a brain activity. So that's another thing that many men don't kind of realize. It happens together that's why they think it's the same thing, but it's not. They're kind of
because you can have an orgasm and have that pleasurable experience without actually having any ejaculate coming out.
Correct. That's right. Or you can visualize something erotic, or, you know, imagination goes a long way, and you can feel an orgasm. And an orgasm, there's no definition. We can't objectify orgasm. There are some physiological changes that occur during orgasm, but essentially it's everyone's own subjective experience of the maximum peak of pleasure in that moment.
Good. About how many people does premature ejaculation affect? Do you have any statistics on it?
I do not actually.
Yeah.
Ooh,
No, I
I'm
know.
sure,
I should have added that. That was just kind of a spontaneous question. I would imagine it's pretty high, at least at some point. Maybe it's not a persistent issue, but I bet it's high. At least once or twice. Right.
I agree with you, because again, like it may happen across someone, you know, guy's lifespan. It doesn't mean that it's pathological either.
Right,
and I think that in the medical system, we're so quick to medicalize and pathologize something like performance anxiety, for example. That's very common, but not often talked about. And the other thing is that, you know, a lot of research studies do go underreported. You know, not a lot of men are talking about these issues. How accurate are those statistics? Like pelvic pain for men, it can range from 2 to 17%. I mean, that's a wide range. I really hold lightly to statistics, but it can happen. And if it does, know that it is very alarming for that person. But the message about getting, you know, that there's help, that therapy can help, sex therapy, physical therapy, very much so like the messages that you are portraying on your, you know, feed and what you're doing out in the world. Yes.
So I think in your blog, I think you said, like, if you want help, you can get help. Like 100% can be helped with it. So it's not like, it's not like you're beyond, even if you've had it for a long time. So,
correct. Yeah, because we're always changing, and these are just, again, patterns. And so if we can start to instill hope, like you said, confidence in one's body and ability to function. I like to use a lot of mindfulness techniques, you know, being aware of one's own sense of inner, how am I doing in my body, again, with these muscles. You know, then you start to kind of integrate that into one's life and relationship. And you want to do that in a way that takes the pressure off of performance. So that's the thing. It's like, it shouldn't be too clinical. We want you to experience pleasure in your body and safety. That way you can have a greater sense of control. So it's really important to combine manual therapies, exercise, and training with, you know, the cognitive behavioral aspects of what's happening for that person as well.
Good. Okay, so this question, I'm sure it depends, but when is the average length of time before a male ejaculates? And I understand also that it's subjective. So just because, you know, one person is doing it early, they may be pleased with where they are. So that's okay. And one person is doing it later, they may be pleased. But is there a sense of, is there an average? Is there an average?
I've heard averages. I know people love numbers.
I know,
Please hold lightly to numbers. I will preface this. I know. But it's a trajectory. You know, again, you might notice yourself lasting longer in certain contexts and circumstances, or with different individuals, or with yourself versus it depends. But I've heard and I've read that it might be anywhere from an average of 5 to 6 minutes.
Okay.
It's an average.
Yeah. Don't get stuck on the
lightly
number.
to it.
So if you can't
Please.
last till 5 minutes, if you're happy at 3 and your partner's happy at 3, fantastic.
By all means. Right. It's all good.
Yes.
It's all good.
Yes. Good. Okay, so how do I talk to my male partner about helping him with this issue without offending him? Any suggestions on that?
Ooh, that's a good question. That's a really good question. Let me think about that question, because we want to approach a very intimate topic using a soft startup, right? So we don't want to come off defensive or saying like
something's wrong with you.
Yeah, right. What's wrong with you? Maybe you should read this, you know? I would probably ask your partner if they think that if they think that it's a problem for them, or how are they feeling in your relationship. It's all about communication and how we go about communicating, and really it's bringing it back to, well, how would you like to have somebody address an intimate issue with you? How would you like someone to bring that up? And it's never easy to do, but again, make it fun and also very supportive. If that person enjoys humor, you might bring that into the mix, but really being transparent, communicating. There's the Love Decks or Love Card Decks by the Gottman Institute, and they're all about relationships. It's a free app, and it's a game. There's a game that has, I can't remember, but it talks about certain questions you can ask your partner. Nice. And then you ask each other, and you can make it into a game. So it's called the Love Card Decks, and it's the Gottman Institute, and it's a free app that you can download. And I think that is a great conversation starter. About well, what do you like in bed? And you might start to just say can we try something? Because I really like it when you do this. Yeah. It's all about, bring it back to you, and don't say you.
That's what I was going to say. Bring it back to you. Mm-hmm.
Yeah. Be like, I really enjoy when you do this, or let's try something fun. Again, if that's accessible to you as a couple, and there's always got to be some baseline and really communicating and being able to trust one another to feel vulnerable. And intimacy is about the relationship, not just in the bedroom, but with all your relationships, and also about vulnerability, like I mentioned, trust, and being able to express yourself without feeling judged. So just if you keep that in mind when you're communicating with that person, with the person in front of you, know that empathize with them and show them that you love them, and then bring it back to yourself and say, I really like it when you did this, or so.
I love it.
I hope that answers a very
I think so. Question. I think that was good. That was good. So how do we treat this as PTs? What could somebody expect if they were coming in to see you for this?
Absolutely. So we would assess, first of all, we want to get your story. Why is this distressing to you? What do you feel better would look like? What are your goals? And as a physical therapist, or even a sex therapist or sexologist who works with male bodies with these issues as well, but it's looking at the other underlying issues that might be there. Okay, maybe it's relationship dynamics that are not conducive to the sexual accordance between the two people, right? Self-confidence, self-esteem. I'm not saying we're psychologists by any means, but if you do, as a physical therapist, notice that some of these things may be playing into that person's life, then having the conversation of saying, hey, I think we need another person on our team, because we can certainly work on coordination, muscle training, biofeedback. I've read that electrical stim to the pudendal nerve could be helpful. But it's really just about getting that person to feel confident and safe in their body, and to educate them about this part of their body. Again, a lot of people don't know how sexual function works for them in their body. Yeah. They have no clue that your nervous system and your brain and all the neurochemicals, all of it, and so I think part of our role as therapists is to lay the groundwork of educating someone about, hey, this is how your body actually works.
Yeah.
And some of the things that you might be experiencing are quite probably normal,
Yeah.
you know?
Yeah.
So
Don't
it's
worry.
normalizing things. Yeah, right. Like normalizing things and supporting that person and really working together in a collaborative effort to help meet that person's health and wellness goals.
Yeah.
So I think that is the crux of our role. And also, again, a thorough therapy examination, physical therapy examination. Again, people are worried that there's something wrong with them, that they have nerve damage, or, you know, whatever they've read on the internet can be quite scary. So, you know, we do the thorough exam, we explain what we're doing, why we're looking for these things, and then we set up a treatment plan based on that person's individual goals and needs, and then, you know, wrapping them up in resources that they may need for their plan. So
good. Can you give some idea of external and internal treatment options? And would everyone coming in expect to have an internal assessment?
No, I love that question. Okay, so you don't have to do an internal assessment at all, actually, for, you know, even sexual dysfunction. Depends on the person. If that's a goal of theirs, for example, maybe they are having pain in addition to sexual dysfunction, and you want to map out areas that feel good and also that feel kind of cranky. And if it is accessible and applicable to the person who is going to receive this examination, you know, are they doing sexual activities and things that involve their anus or not?
Right,
you know,
right.
At that point, it would be relevant, right? And so that's when I do the internal examination. But the key here is always asking for permission. Ask if this is something that that person wants to participate in with you within that context. And then again, think to yourself as a therapist, why am I going to do an internal assessment? How is this going to help this person with said issues and what's going on in their life? We certainly don't want to be another cause or issue of anxiety.
Like, oh,
or,
I have to have a finger.
Yeah, no, you don't. You do not have to have a finger in the butt to get better. Really, like I said, it's really about educating, showing the anatomy models, having them to feel. It's an internal experiential experience when you work with the physical therapist. I think it should be how you feel in your own body, touch your own parts, feel what it feels like. I use a long standing mirror. I have people stand in front of a mirror if they're comfortable enough. And I say, look at your parts moving. That's exactly it. And I'm just coaching them. I'm not there to use my hands to fix them. I am there to support them. And again, if you deem that it's necessary to proceed with an external or internal, which I think there's never a necessary, but if you feel like that's appropriate for that person, it could be helpful, but again, doesn't have to happen. So
excellent. Good. Okay. And this is a big one. So I was reading your blogs last night. So if you guys haven't read, she has 2 blogs on premature ejaculation, part 1 and part 2. Incredible information. So would you share with us your 4 tips for a home program for premature ejaculation? And do you have your model?
I do. Yeah, well, I have.
Yes.
Yes. I have tons of toys in my office. I just chose a selection. Anyway, so 4 tips. Again, this is not the be all end all. They're just ideas. So I like to preface that I've learned from my, trainings and other people. So I'm just gathering that, and from my patients. They're my greatest teachers, so thank you. Yes. But anyway, so the first thing, like I mentioned earlier, is getting to know your private parts, right? So having it as, just feeling what this part of your body feels like. Maybe you sit on a ball, or you sit on a firm surface with a towel underneath you, or maybe you just put your hand between the area of the anus and the base of the penis and cough, or do some activity, tighten like you're going to hold back pee, or shorten the base of your penis, stop a fart, and just feel what it feels like for these muscles to be active in action, right? So just be aware, because awareness is key, and having that control of, okay, I can squeeze and then I can let go. Because when you ejaculate, guess what happens? Squeeze, let go, squeeze, let go. You gotta let go. And that will change the strength of the ejaculate and how things kind of expel from the penile urethra, from the penis. It might affect the, volume. All sorts of things can affect volume. I won't go into that, but, it can impact your sexual performance per se. So really knowing these muscles of squeezing and letting go, that again sends signals up to your spinal cord, to your brain, for coordination. It lights up the neurons there. So if you can have a better understanding of what do these muscles feel like for me? Am I aware of when I'm squeezing and letting go? And how does it feel for me? And then when you are working with yourself or with a partner, you can better able to control what's happening in the bedroom, right? So it's like being aware of, yes, you have confidence, and you also are, again, you're mindful of like being mindful in that moment of, which is another tip of be mindful of when you're getting close to climax. So it's really helping you to tune into your own body and the sensations of your own body so you can pick up on the cues earlier, and then you could stop and then start again. So that's another technique. So number one is getting familiar with this part of your body. Anatomy. And then number two is practicing with start and stop. So being mindful in the moment, feeling your body, feeling the sensations of, the good stuff. And then knowing like, okay, when is that time where I usually would climax, know the feelings associated with that. And then once you can catch that earlier on, you can stop, change up the position, less stimulation. Breathing techniques are very helpful to kind of like calm things down and then start again. So, and then in those moments you will have a change in how firm your erection is. No worries. That's a normal thing because you've gone from being really excited to, okay, I'm cooling down here.
I'm trying to hold it a little longer.
Right, exactly. And then that's when you can use your pelvic muscle contractions as well to like squeeze and let go, squeeze and let go. So it really does depend on the person and for them to try these techniques in the context of which they're having difficulty, or with early ejaculation.
Good.
And then a third one is the squeeze technique. Yes. So what you would do is, it has been said to stop the ejaculatory reflex. So it kind of like, again, it's a distraction, I think, for the nervous system. Yeah. So what you would do is you would find the glands or the head of the penis, and you'd place 2 fingers around the rim of the glands, or two finger pads like sandwiching, and then the other one on the frenulum. I don't know if you could see that here.
We can see it.
And then what you would do is you would squeeze quickly and let go, squeeze quickly and let go, squeeze quickly and let go. You do that 3 to 4 times. Of course, breathing. And then getting back to what you were doing, whether with yourself or with a partner. So it's called the squeeze technique.
That's very similar. Like if somebody had a urinary urge and they're using their hand to provide some external pressure, right? To keep that pee inside. We're trying to squeeze it off. Good.
Yeah. And the nerves that go to your penis, they extend all the way to the glands. And this is the most sensitive area as well. So what you're doing is you're using different mechanoreceptors, different nerve cells in the area, kind of like you would do with pain. Like if you hit your thumb with something, you rub it, it doesn't hurt as much because you're using different sensors in that area to distract the signal. And I think that's kind of how it works from a
like a distraction standpoint. That makes sense.
Yeah.
Excellent. I love it.
And perfect. And then we talked about taking a break, mindfulness, getting to know your private parts, start and stop, and the squeeze. So I think that covers everything.
Good. So if you guys have any questions or you want to read more, because she goes really into incredible depth on her blog. So go to the link in her bio, go to her blog and read, and it's incredible information. And she has a video of what she just demonstrated too.
I do.
I love it.
Yeah, I do.
I love it. Okay, so are there any medical tests, like, again, this is kind of subjective, so we don't have, you can't do a lab test to say, okay, you have premature ejaculation.
Nope. No, not that I'm aware of. I could be wrong, but it's hard to, because again, it would be a structured setting, and sexual function just doesn't work that way. It's context dependent. So, I don't, unless there's actual nerve injury or damage that
and then you would have other types of tests.
Exactly, right. But in terms of premature, it's all subjective, and there's really, like I said, even defining it is quite difficult.
Okay, so somebody has premature ejaculation. How do they go about getting help? They want to go to a therapist. Tell me a little bit, because I know you have some online programs and some in-clinic programs. Tell me about those, and then if they choose not to go that route, is there a book or another resource or a video? How would you connect them with help?
Right. So pelvic floor therapy would be great, particularly if that person that you're reaching out to is familiar with men's health, like myself, and they're very comfortable with working with male body parts. That would be one avenue. You also have a lot of sex therapists and sexologists who work with men with sexual health issues. Those are really great resources, I would say. And looking in that route, because they're really like almost like the first line, I think. And then they work in conjunction with therapists, physical therapists, to help with all the manual therapy and training parts of things. There's a great website called Sex with Dr. Jess.
Okay.
And she's out of Canada, but she actually is creating a premature ejaculation online do-it-yourself program.
Okay, cool.
And I was collaborating with her on that. I'm a guest speaker to talk about the pelvic floor and what you can do. So I would look out for that. And I have, like you mentioned, Jeanice, my blog posts. You guys can get in touch with me as well. My male program is for pelvic pain. So if you are suffering with pelvic pain, that would be a good resource to do it yourself. I also have a women's version. And then a podcast. So my podcast talks a lot about men's sexual health. I have a lot of guests on there, sexologists and other practitioners that address premature ejaculation. And there's also a book called The Penis Book by Dr. Aaron Spitz. That's a wonderful resource. I also interviewed him on my podcast. So yeah, there are a lot of resources there. Just don't be shy to reach out for help. That's the thing. Like, doctors aren't going to ask, and you're probably not telling. So I really recommend, like, if you are struggling with something down there, don't be afraid to reach out for help, because you don't have to live like that. And there are changes that can happen to make your life just feel better, and you feel better in your body. So
yes, I love it. And so you're in Asheville, North Carolina.
I am. Okay. Yep, Asheville, North Carolina.
And we will, in our YouTube caption, we'll give a link to your website and your blog and anything else that you would like to share with people before we close for today.
No, I think we covered everything.
Yeah.
I'm so
I love
excited
your
to
energy.
be here with you. Thank you so much. I'm super passionate about it.
Yes,
So,
it's incredible. Well, I will be tapping you for more men's health information. Thank you so much for taking the time out of your schedule. Everybody here, thank you for joining us. This will be live on Dr. Susie's story for 24 hours. And then within a few days, we'll have it on our YouTube channel. It's My Pelvic Floor Muscles, No Spaces. So thanks again for joining, and I hope we get to meet in person one day.
Likewise.
Okay, take care. Bye-bye.
Bye, everyone.